Okay, about to get it started. Let me pin a comment. One second. HIV is. Okay. All right, there it is. Hey, so.
Hey, Jamaya.
Hello,
How you doing?
everyone. I'm finding you on this beautiful day.
Yes, enjoying the weather, trying to get
Yes.
outside as much as possible.
Yes. Alright, so I guess we could just give it like a minute or so, let these views roll in and get started.
Yes. Hey, Kim. Thank you.
What can you say? Oh, she said yes, pink. Oh, we both have on pink, so your hair and my jacket.
Yes. 1 second. She is. Just give me 1 second.
Okay.
Let me let her know. Can't do that.
All right. Hello, everyone. Yes. I hope everyone's having a wonderful day.
Hola.
And hi, Kim.
How's it going?
It's you.
I was gonna ask you, well, first of all, how's everything? You doing good? Yeah. Yeah. Janice said she saw you at the vaccine. Yeah.
Oh, she was in here.
Yeah.
Oh, we didn't even see
I think
her.
she's trying to say hello, but I think.
1 second.
Kind of crazy.
All right, I'm back.
Okay. All right. Let's go and get started now.
Okay. All right. We can get started.
Okay. All right, so I guess we'll go ahead and start with introductions. For those who don't know, my name is Jamaya. I'm a peer ambassador here at Whitman-Walker, and my pronouns are she, her, hers.
Peace, everybody. My name is Sol. I'm one of the social media influencers for community health, as well as an art educator for Whitman-Walker's New Cultural Center, the Corner, DC. My pronouns are. So during the Whitman-Walker's community health department to the social media platform, we cover HIV, STI practices, access to care, social determinants of health, and general public health interventions. Our series of action also focuses on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The Whitman-Walker team is here to educate and support y'all.
All right. So today, you all have the pleasure of tuning in from both RealTalk DC Instagram and Whitman-Walker's Instagram, because today is National Women's and Girls HIV/AIDS Awareness Day, with the motto, you, me, we, changing the face of HIV. Today is, like I said, National Women and Girls HIV Awareness and AIDS Day, a day to raise awareness about the impact on women and to show support to women living with HIV. There are about Can you hear me, Soul?
Yeah, I can hear you.
Okay, sorry. Okay, so again, there are about 1 to 9 women living with HIV that are unaware that they have it. Knowing your status on HIV gives you the power to have control over your health. And on that note, get tested. PrEP is also for women too. For those who didn't know, I know a lot of people in like commercials tends like getting confused, but PrEP is for women as well. So talk to your doctor about getting connected with PrEP today to help lower your chances of getting HIV. And one more point I'll bring up is the Office on Women's Health wants everyone to make the best choices when it comes to protecting their health. Abstinence is the best way to avoid HIV, but if you decide to have sex, there are steps you can take to protect yourself and others from HIV.
So HIV affects women differently. HIV can cause unique health problems for women like gynecological health issues, problems related to sexually transmitted diseases, some STDs like genital pelvic inflammatory disease, and chancroid can happen more often or harder to treat in women living with HIV than in negative women. Vaginal infections in women living with HIV. Vaginal infections can occur more frequently, harder to treat, to name a few. Um, Increased risk of cervical cancer. Women with HIV have a higher risk of cervical cancer. It's important that they be ready for this disease. The risk of heart attack is also especially a concern for women with HIV. Women with HIV have a heart attack. HIV, keep that in mind. HIV works as well for women as it does for men. However, medicines can have different side effects in women than men. For example, nevirapine side effects are a higher risk of rashes and liver problems with a higher CD4 count. Um, Women with HIV may also face other health concerns as they age. For example, menopause. Women with HIV may enter into menopause younger or have more severe flashes than women who do not have HIV. Researchers also think that the drop in the estrogen after menopause affect women's CD4 counts.
Yeah, that was a lot. Definitely something I didn't know either. So I'm glad to be enlightened. It's also said that birth control and pregnancy are 2 issues that can also affect HIV treatment in women. So, birth control for some HIV medicines may reduce the effectiveness of the hormone contraceptives, like the pills, the patches, the rings, or the implants. Basically, the different methods of birth control there are. Women taking certain HIV medicines may have to use an additional or different form of birth control for it to be effective. And with pregnancy, women with HIV taking HIV medicine during their pregnancy and childbirth reduces basically to reduce the risk of mother to child transmission of HIV and to protect their own health, of course.
So some more key points I want to share with y'all. According to the Center for Disease Control and Prevention, the CDC, 19 of the new HIV diagnoses in the United States and dependent areas are among women. The most common way that women get HIV is through a male partner who has several factors to HIV, the risk of HIV. For example, during vaginal sex, a woman risk of getting HIV in general, receptive sex here than sex. Um, Women with HIV medicines during pregnancy and childbirth to prevent mother to child transmission of HIV and their own health. Though HIV diagnosed women have declined in years, more than 7,000 in HIV diagnosed in the United States and dependent areas in 2018. In the United States, risk factors transmission are having anal or vaginal sex with a person who has HIV without a condom or taking medicines to prevent or HIV, sharing injections such as needles with a person who has HIV. Social barriers such as racism, discrimination, and HIV stigma have a major impact on health and well-being. These factors prevent women from seeking and receiving high quality care, including testing, treatment, and other prevention services. But addressing these barriers and encouraging safe communities can help improve health outcomes for women.
Ooh. So we know that was definitely a lot. That was just a whole bunch of information and facts. It was a whole spiel about the impact of HIV on women. But we still want to encourage everyone in the live to learn more about HIV and to continuously educate yourself. Again, PrEP is very important. Is a very important prevention tool for HIV. And if you would like any more information on PrEP, you can call us at 202-939-7690 or email prepclinic@whitman-walker.org for more information.
If y'all have any questions around sexual health, HIV prevention, or COVID-19, you can call our resource line at 202-797-4439. Also call that same number to schedule a free HIV testing appointment. So again, that's 202-797-4439. If you're in need of testing, you can schedule an appointment by emailing appointments at whitman-walker.org or calling let me let me run it back.
Yeah.
Appointments at whitman-walker.org or calling 202-745-7000. Keep up to date on the COVID-19 vaccine availability in the city and at Whitman-Walker by visiting our website at www.walker.org. Thank y'all so much for joining this live. That it was informative and that you something and can add this information to your safe sex toolkit. Join us for the bag later.
Yes, tune into that.
The bag corner is going to be our last bag of the season. So tune in, have a good talk about how we can continue to prevent HIV in our.
Yes.
Thanks, Jemiah.
Yes, thanks. So, bye, guys.
Bye.